Can you hear me? Yes. Okay. My name is Dr. Razani, or Nooshin. I'm a pediatrician and super, super proud and certified nature champion. Yay. It's a tremendous honor to be amongst partners in envisioning and creating a good future, a good and healthy future, which is absolutely possible. So here's the current situation. Americans spend about 7% of their week outside. That's about half a day a week. This is according to the EPA in a survey they did in 10 areas over the US over 2 years in 2001. If you add about 6% of our time in cars, we spend 87% indoors. So the human species in the United States is now domesticated to the point where it is inside walls almost every hour of the day. This is less than before, and when we are outside, we spend less time in nature, and when we're inside, we're more sedentary than we've ever been. So, is that a problem? This trend towards indoor sedentary living has also been parallel with a rise in chronic illness. Heart disease, stroke, cancer, obesity. And at this point, about half of US adults have a chronic illness, about a third have multiple. In children, about 1 in 5 are obese, and we see rising rates of chronic illnesses that we did not see before in pediatrics. Chronic illness is common, preventable, and it also happens to be costly. We spend 7% of our lives outdoors. Is this related? Much of the burden of chronic illness is attributable to a short list of key factors. Some of them you can quickly make the connection to indoor sedentary living, but what about others? What about tobacco use, alcohol use, and things that have to do with mental health? Okay, so we spend 7% of our time outdoors. This shift has also paralleled a rise in loneliness as an epidemic. About 1 out of 3 people who are over 65 live alone, and about 10 to 46% of them report feeling lonely. In this age group, loneliness increases mortality. So it depends on how you measure it, but the increase in mortality can range from 26 to 32%. And in a meta-analysis, where efforts to increase social connection and social support were compared with other health interventions, such as tobacco cessation and increase in physical activity, loneliness or adding social support easily eclipsed the benefits of other interventions. We spend 7% of our lives outdoors, and we also know, as we heard earlier, that access to green space when we're outdoors is inequitably distributed. We also know that there are great inequities in health outcomes. The bad news is that the way we are living is increasing chronic illness. I've also suggested that it might be responsible for a rise in loneliness, social isolation, inequity. I also want to throw out there that it may have something to do with the current environmental crisis. As a public health practitioner, I absolutely see climate change and toxicity and other environmental issues as public health issues. Most Americans are worried about public health issues, but they don't know how or what to do about them. So is the fact that they live indoors and separate from nature part of the feeling of not being empowered or involved? So that's the bad news. The good news is we have learned that chronic disease can be targeted through, even though it impacts a lot of areas of life, there are similar strategies that can be used to impact chronic illness. And many of the same strategies can lessen the severity for many illnesses. And the CDC says that community resources are a key way to combat chronic illness. And so I guess I'm saying that it may also be a way to combat loneliness, inequity, and environmental degradation. How can nature be a public health intervention? Nature has the potential to be a low-cost, readily available resource for preventing and treating chronic illness, health inequity, and the other things I've mentioned. In the past 30 or 40 years, there have been more than 100 peer-reviewed articles making the compelling argument that human beings, in order to be healthy, need access to open space and biodiversity. Now, that can be looked at in many different ways. Some people look at green space, which is tree cover. Some people look at blue space, which is access to water. Some people look at quiet spaces. A very notable study was one looking at all death in the UK out of 40 million people, and showed that those who had access to green space had lower rates of heart disease and mortality, and that the effects of inequity and poverty were less in the more green spaces. So what happens when you enter tree cover? Within minutes, your breath rate is lower, your heart rate is slower, and your blood pressure decreases, and then it plateaus. It doesn't go all the way down. You sweat less. Within 15 to 20 minutes, you perform better on cognitive tests. Your concentration is what they call restored or reset. Children with ADHD have improved attention spans. Stress hormones are reduced, inflammatory markers are reduced, and glucose levels go down. Within an hour, you may find that you've had about a half an hour more of moderate physical activity. And if you're lucky, you may experience the emotion of awe, which is measured through vagal nerve measurements. And awe is a perception of fear and pleasure at the same time, and is correlated with the development of empathy and with focus going from internal rumination to external, and has the long-term consequence of decreased anxiety and depression. Another thing that happens in nature is that the quality of human interactions improve. So in neighborhoods and areas where there is green space, there is more social contact, more intergenerational social contact. They report benefits from the wilderness, but they also remember the relationships that they developed. So over the lifespan, what is the impact of not having all these things? So we're here to discuss giving a prescription or introducing nature to people, but I'd like to flip it a little bit. And I'm going to introduce you to a term which you may have heard, which was coined by Richard Louv, which is the nature deficiency syndrome, which is basically to think about what has the impact been on human beings of not being in nature all the time. So I'm a pediatrician, and in addition to treating illness in children, I think about how to grow children and allow them to have normal, if not exceptional, human development. And the research is clear that for children, being in nature is very important. It doesn't have to be big or beautiful, but most natural landscapes are diverse, meaning they have little sticks and rocks and also places to run. And so they lend themselves to creativity, exploration, and things that it turns out are very important for the development of your cognitive thinking, executive function. I have a picture of fort making, because the things that children used to do, or hopefully some places still do, but things that children did in nature on their own, separate from adults, also were part of their emotional development. There is a researcher that has found that in many cultures, children create forts right before adolescence, almost like a cocooning process. And the tough part about being a pediatrician is you also have time frames where you can influence things. And when you miss them, you miss them. So after 12 or 13, children are not making forts anymore. They're not as engaged in nature. And they may be missing the opportunity for these important milestones. Another thing that happens in natural landscapes is the opportunity to interface with not only other people, but other organisms, and to develop a sense of self that includes the non-human, and includes, in this day and age, humans that may look different from you. Partnership between healthcare and those who care about the outdoors is not only possible, but it's extremely important and has a tremendous amount of potential. And actually, we really need you. We are lacking some randomized trials and evidence on how to do this, but I think I've presented that there is a huge amount of literature already existing that can really support these partnerships. So at my hospital, I work at UCSF Benioff Children's Hospital, Oakland. We had the tremendous luck of partnering with our local park agency, East Bay Regional Parks District, to really think about how do we create a clinical intervention that extends nature to families, and to take this question very seriously. Now, we are the safety net provider in our community. We're the largest safety net provider in the East Bay. We take care of about 12,000 children in our primary care clinic. 98% of them are on Medi-Cal, which means that they're near the poverty level. We see a diversity of patients. 58 languages are represented in our clinic. And when I say East Bay Regional Parks, everybody here probably knows what they are, but they are incredibly special. And I hope that I got the numbers right, but there are more than 65 parks, more than 100,000 acres, correct? And more than 1,000 miles of trails. And this is right in our backyard. I'm talking bay, waterfall, lake, redwood forests. And so the opportunity to partner was incredibly special. And I'm going to give you a little bit of details as to what we've created. I did want to say one thing, is that we do share a mission, and we see each other as sharing a mission of creating health in our children, communities, and ecosystems. That is a shared mission between us. Next slide. So we worked closely over the span of, I believe it's been 5 years, to design a clinical toolkit or prescription tools that would help train our staff in knowing how to talk about nature with patients. And we really think about this as a behavior change intervention, the same as we would for any other behavior change intervention. I'm sure you'll be hearing about many of these tools today, but our tools included a really short script for healthcare providers and a postcard that has 10 carefully chosen parks and bus routes to those parks and some suggested activities. And this process of developing these was very interactive and iterative between the park staff and our clinical staff. As part of our work, we actually conducted a randomized controlled trial to see whether or not our park prescriptions worked. And I'll tell you a little bit about that later. I'm going to just use that data, which was collected from 78 parents and children, to give you a snapshot of the types of families that were receiving park prescriptions. We enrolled caregivers and also children, and these little graphs are from the caregivers. The majority were female. Ages spanned all over the spectrum, so we have lots of grandparents caring for children. Education was overwhelmingly high school. 67% African American population that we serve, and then the others were quite a diverse group of patients. I don't have it here, but about 19% spoke a language other than English at home. 17% were immigrants. Also within the African American group, a portion of them, 10 out of the 60 were, or 50 or so, were recent immigrants from Africa. The first thing that we did was just to find out whether or not people are interested in nature. We measured something called nature affinity, which is a scale that's correlated with future environmental action and environmental stewardship. What we found is that at baseline, families who may otherwise be assumed to not be interested in nature really valued nature. And many of them are just one generation away from memories in nature. So this is of the parents, how many said they agree with the statement that they spend time in nature as a child? 68%. How many say they spend time in nature now? 22%. We also got a sense of economic stressors. Since your child was born, how often has it been very hard to get by on your family's income? How well are you coping with being a parent? I value spending time in nature with my family. This question was of the children. Playing outside makes me happy. So at baseline, we also asked about access to nature. As we said, people value spending time in nature, tended to feel safe, but ranked a little bit lower on having money, transportation, or knowledge of how to get into nature. So early on, knowing this about our patients, we asked the parks to supplement our park prescription program with things that would help decrease the barriers to getting to parks. And we asked for food, transportation, for the program to be family-based so that a child receiving a prescription could bring anybody that they want. And East Bay Regional Parks said yes, even though we just kept asking for more and more and more. So we're extremely grateful. And what ended up happening is that we have monthly shuttles where patients meet at the clinic and go into parks. And our current park prescription model is embedded in our electronic medical records so that when a provider prescribes nature, they can click a button for a referral. There's also a screening question for nature. When they click the button, the patient is scheduled in our SHINE, it's called, I'll tell you that in a moment, but it's scheduled in our park visit clinic once a month. And then our hospital computer sends them an automated reminder, just like if it was any other clinic. The name of the program is SHINE, which is Stay Healthy in Nature Every Day. We are now into our third year of monthly outings, and we just completed our 33rd outing. And these outings have been extremely diverse. Sometimes it's just me and my kids and 2 or 3 families, or 2 or 3 people, and sometimes it's been up to 75 people showing up. And I think that what we've learned over this time period is, first of all, we are extremely grateful to the parks for not giving up when nobody showed up. We are extremely grateful to them for everything that they do for our patients when we get to the park. And in many ways, we rely on them as part of the healthcare team. You can do the next slide. I'm not going to present our findings yet from our study, but I can tell you a few of the stories because we've learned a lot from the patients that we've seen. A little bit that we've learned is how much it takes just to show up to one of the park outings. We have an example of one mom who drove to the park with her kids, but stayed in the parking lot because she was so nervous to come out of the car and be part of something social. There's another example of a family, a mother who was fleeing from domestic violence and was staying in a shelter. We couldn't reach her to follow up with her about coming to the park. She happened to have Mona Ko's phone number, if anyone knows Mona Ko. She's from East Bay Regional Parks, and ended up getting a ride from the park person to come to our clinic, and has since actually kept going to other East Bay Regional Park outings, and I believe that Monaco even helped her through her network with some job opportunities. We have examples of grandparents who cannot walk or are socially isolated for health reasons, and other families meeting them on the shuttle will pick them up. We have quite a few immigrant families who would not go to parks because actually they are afraid of you. And they have been very helped by the fact that our staff is often of color and immigrant ourselves. I think we've also learned a little bit about the depth of connection to earth and land. And so when you work with people who are displaced or who are marginalized on many levels, asking them to visit a park becomes a little bit complicated. Because if you used to have a very deep relationship with the land near you, a relationship where your culture and your rituals were based on farming or actually being able to manipulate the land, sometimes it may seem a little bit trivializing or patronizing to say, just visit a park and that can replace everything you've lost. And so we are learning how to navigate these conversations in very deep ways. We've also learned that a lot of people don't like nature and are stressed out by it, and that we need to normalize childhood behavior and also just some of the discomforts, physical discomforts that you experience outdoors. So this is our experience so far. We will be reporting the results of our trial at the East Bay Regional Parks Board meeting in the next few months. I'm extremely optimistic that this model and others can really work to help people realize that they do belong out of doors, that if the 7% that you are out of doors is because you're afraid to be out of doors, the other part of the time that there are resources to help you connect. And I'm extremely grateful for this opportunity to work together for a better future. So that's all I have to say.